Hello, Facebook. Thank you for joining me again this week for an episode of Bare Your Soul. This week, we are bringing Arianne Missimer to you. She is the founder of the Movement Paradigm and also a former American Ninja. Welcome, Arianne. Thank you for joining us tonight.
Thank you so much for having me, Michael.
Absolutely. We've known each other for a couple of years now through Dr. Emily, the founder of Naboso, and you even came to our wedding, which was...
Yes, I did. I was honored.
It was a great weekend, and we thank you for that. I'm bringing you on this week. As everybody knows, we kind of dive into the philosophy and theories behind everybody's theories on movement and how they incorporate barefoot movement into their practices and into their fitness and wellness routines. And Arianne, I know you are a BTS trainer and you're certified. That is Dr. Emily's education system. And I know you're a big proponent of that. And we thank you for all your support through the years and are trying to share you with our world a little bit more. So thank you for joining us.
Thank you.
Let's dive right in. Tonight I want to talk a little bit about your philosophy on movement and how it's shaped your business and your brand and your persona as you've come up into the industry.
Absolutely. So I always say I think movement is such a gift and it's something that we should all cherish. I think so many of us take it for granted, especially when I speak with my patients and clients. So I'm a really big believer in moving intentionally with purpose and making sure that you're building your body up as opposed to breaking it down. I think a lot of current fitness models tend to gravitate towards that. And I really think there can be, all things can be included, but I really try to focus on building your body up.
Mm-hmm. And then how do you go about, for you specifically, how do you go about that? What is your approach to starting that and building that up?
So I always, when I'm evaluating people, I do a movement assessment, I do the foot and ankle assessment, that's all in the BTS programming. And then breathing assessments, I do neurokinetic therapy. So just a variety of different ways to assess the body. Mm-hmm. And really just start by breaking all those movement patterns down to their smallest pieces. So using a developmental approach, using a movement from the ground up approach, and really trying to work on reflexive stability so that someone can really be able to generate force and power and strength the way that they should without getting injured.
That's awesome. And I know you you have a center out in Pennsylvania now, right?
I do.
And decorate it, design it, and put it all together. Yeah. It's pretty great. Can you tell us a little bit about it?
Yeah, absolutely. So this was always my dream to open up a multidisciplinary practice. So I opened up an integrative health center and I have 7 different practitioners. So 2 different massage therapists, body workers, personal training, yoga, psychology, and then I'm doing physical therapy, nutrition, and movement coaching, all with the focus of functional medicine.
That's awesome. That's awesome. And how has it been through COVID? Have you been able to keep your doors open? Did you have to shut down? How's it been for you?
So far, it's definitely been a challenge, but I'm doing primarily virtual, and then I'm also doing some in person, and then some of the other practitioners are doing mostly virtual as well. So I lost 1 tenant so far, so that's not so bad. and then considering the circumstances.
Yeah. And where is it in Pennsylvania? If you don't...
It's in Downingtown, Pennsylvania.
Okay. I know Pennsylvania got hit a little hard, and the governor there put some heavy restrictions on you guys for a little while. So.
Yes, yes, and we're all fighting back.
Exactly. Yeah, more people need to start fighting back. But that's a whole other show. We'll go over that.
We won't get into that.
Right. During your rise through the industry, what was it that brought you to really give your attention to foot functionality and incorporate that foot, the core of, and how it builds the body and like you were talking before, from the ground up and building everything up? What really brought you to the attention of that?
Yes, it's very specific. It was my own personal journey, and I was getting started in the personal training field, and I was becoming much more active with strength training and plyometrics, and I kept having injuries. So I was having knee pain, hip pain, back pain, and I continued to go to all of these different experts in the respective field, orthopedics, PTs, and everyone kept saying to me, you have flat feet, you need to wear orthotics. And so not a surprising story. So
Right, yeah.
I need to go down that journey, and then I would get more rigid orthotics, and then people would say I need more support. So I'd have motion control shoes, and it was a disaster. And finally, I started training for my RKC for kettlebells. And I was so nervous to take my shoes off because I thought my body's going to just collapse.
Right.
So I started training, and then I realized, wow, I can do this. And then I started to feel better. And it really just was this huge aha moment that I realized, wow, I need to train from the ground up. I need to train my feet. And then I was really interested in learning the science behind barefoot training, which is when I found Dr. Emily. And because I was searching for her.
Yeah.
No, I didn't know I was searching for her, but I was trying to figure out the science. And so then I started following her, and then that led me to MI training.
Okay. And how long ago was that?
Gosh, so I think we'll say in 2015, I did the master instructor training. So I think it was probably, I'd say a few years before that, maybe 4 years before that, I started like really kind of getting into it.
Yeah, that's awesome.
Mm-hmm.
How does that now intersect with your practices? You know, we brushed up a little bit on, you know, how you incorporate it, how you bring, but when you were developing your approach to everything that you do, how did that really incorporate into it? How did you start to bring all of that together?
I think because it helped me personally, my journey so much. And then I was able to help so many other people with it, and training this way and looking at the body this way, that now it is such a foundational part of what I do. So every patient that I work with, regardless if they come in for neck pain or elbow pain or knee pain,
Right.
that I'm doing barefoot training with them. You know, teaching them about concepts of fascial tensioning and reflexive stability and all of those aspects, so that they can learn how to really build their body up.
Right. And now, do you do this barefoot with them? Is this?
Yep.
Do you typically
Yes, my facility's barefoot. So as soon as you walk in, you take off your shoes. So yeah, they don't really have a choice.
That's pretty amazing. That's a rare occurrence in the industry. You don't really find that very often.
I know. I kind of, once I opened my practice, I thought, you know, I'm going to just make this happen. I'm just going to make it the norm.
Mm-hmm.
Sign at the door, and it works.
And then how do you find, what kind of feedback do you get from your clients and from your customers and patients?
I think that for the most part, I would say 95% of the time, everyone is totally on board. I might have a few people that are, you know, kind of a little turned off by it, but I'll talk about how it creates a cleaner environment. And then I can, once I'm with them, explain the benefits of barefoot training. It's just that initially, like, you know, and I don't walk in the door and talk about barefoot training. But initially I'll kind of talk about the cleanliness piece of it, and then they're typically on board, and then I can maneuver it in.
Yeah. So that's it's funny because, you know, as a director of sales for Naboso, I've been into a lot of physical therapy centers and things like that. And every time I walk in, I'm just surprised that there's no one in there barefoot. I'm always shocked. Like, these people are all wearing shoes and sneakers on these machines that are meant for their feet to actually flex and do the things that they're supposed to do. And they're totally missing all the benefits. It's crazy to me. And then they wonder why they're still stuck there 2 years later. They're still going to the same therapist because nothing's ever fixed. It just blows my mind. It's pretty crazy. So now, go ahead. Sorry, I know you're a user of Naboso and a fan of Naboso. How How do you integrate that, and how do you use that with your patients?
Yep. So I have mats kind of spread out around the facility. So anytime I'm teaching someone all of the barefoot training exercises, that's really when I use it, and I introduce it to them. The benefits gives me a lot of speaking points, educational opportunities to talk about the benefits of even just simply being barefoot, and in addition to using the technology. And then I also sell the mats here. So most of my clients, after they really embrace it, they understand it, they embrace it, then of course they're like, oh my gosh, I definitely want one of these.
I found, even from the sales perspective, once people stand on it and experience it, 9 out of 10 people end up buying it because it's something completely different. It just completely opens your mind and opens your eyes to something different. Yeah.
Absolutely.
So let's change gears for a minute. And maybe you could tell me a little bit about what is it that drives you? What brought you into this industry? What was it about physical therapy and personal training, and what is it that gets you up in the morning? What gets you going?
Yeah. So I think the biggest thing is when my brother passed away, he had cancer at the time. I was his physical therapist when he was going through treatment.
Wow.
He is definitely the person that has driven me in so many ways, and I think gave me purpose. And I feel like my role here on earth is to help people heal their bodies and live with vitality and live their best lives.
Okay.
That wakes me up. That's what drives me every day.
Yeah, that's a pretty big mission. Yeah. Okay. Trying to save the world.
Yeah, that's what I say. When I leave this world, I want to make it a better place than when I got here.
It's a very noble cause, of course. I think most people in this industry, that's really, they come to this industry for that purpose. They're trying to help people, and they're trying to make the world a little bit better. And even if you touch one person, it's amazing. It's also important that people understand when you're building a brand and a business, things aren't always easy. You go through a lot of hardships as an entrepreneur, and as you're coming up into something where you're, maybe a consultant or an independent contractor, as are a lot of trainers and things like that. Building your brand and building something from the ground up is really difficult. Could you share 1 or 2 things that you really had to fight and overcome to get to where you are today?
Yeah, I think the biggest thing is just that it's the constant hustle and constant drive, and you can never stop. Like, it's always, what's the next best thing? What's a different way to do something? And I think the challenging thing is, at least for myself, is that I'm a sole business owner. So it's hard to bounce ideas off of people. And it's just you're constantly thinking of what to do. And I think that is probably like the biggest challenge. I know, and that's sort of an ongoing thing. But I think when you know what you love and you're doing it for a reason that's much bigger than yourself, then it makes all of that easier.
Right. That's great. Can you tell us a little bit about American Ninja Warrior?
Yes. Yeah. Well, the funny thing is that I don't know if you knew this story, but when I was at my master instructor camp with Dr. Emily, that was when I was diagnosed, which was the craziest thing. Yeah, it was the craziest story. And I was literally like in the first day, and I got the call, like, you have cancer. And I was like, okay, like, this is crazy. So anyway, so the foot piece of it, like, really became like a little bit more even a person. But during that time when I had cancer, I was training for I decided to train for American Ninja Warrior. And I trained all through that year during chemo, radiation, surgery, all that. And then 4 months after, I competed on American Ninja Warrior season 8.
So now wait a second. While you were doing chemo.
Yes. Yeah. And I got married then too.
Wait, you got married? You were going for chemo, surgery, and training for American Ninja Warrior.
And I finished that master instructor camp.
Okay.
Don't forget that part.
That's crazy. So can you, if you don't mind, can we go a little more in depth of what we're talking about now? And maybe you could share, what was the diagnosis? What were you diagnosed with? What type of cancer was it?
Yeah, so it was stage 3 liposarcoma. So it's a very rare and aggressive cancer. There's about 12,000 cases a year. There's 51 different types of sarcoma, but only 12,000 cases. So I was diagnosed 2 months before my wedding, and it was initially, I was just going to get radiation, and then they kind of switched gears because it was a little bit more aggressive than they had thought, and I had to do pretty aggressive treatment.
And where was it?
It was in my thigh, so it was a 10 centimeter mass that was like right above my knee.
Wow.
So the interesting thing was that the only symptom I had, because everyone says, did you have any symptoms?
Yeah.
I had a little pinpoint nerve pain in my calf, and it was only when I would sit down or cross my legs. So I kept thinking, maybe it's, I couldn't figure out what it was. And then I kept feeling around and felt this huge mass.
Wow, that is a huge thing to overcome for anyone. And
Yes.
then to add to all of it. So how maybe you can elaborate a little bit. How exactly were you training while you were going through these processes for American Movement? Like, what were you doing to be able to train for that?
Yeah. So initially, when I was in chemo, I was pretty much just doing strength training. So I had chemo for 4 days in a row. So I wouldn't train then, but I would train like the off week.
Yeah, right.
So, which was like for 2 weeks I could train. The first week I felt like crap, but the second week I felt better.
Right.
Then when I was in radiation, I actually did like pretty intense training. I was working out at a ninja gym.
Okay.
I did all obstacle training and, a little bit of parkour. And then it kind of transitioned into rock climbing, and a little bit, and obviously more obstacle training and things like that.
Wow, that's incredible. So how did you end up doing on American Ninja? How far did you get? How did you do?
Not as well as I would have liked. But my main goal was to get through the Quinn steps, which I did. And I was very happy because I was so nervous about my leg, because I thought, what if I had, so much done to it. And then I also had my port in my chest, so I was kind of nervous about that. So I got to the first through that, and then the second obstacle was a log drop. And so the goal was, for my goal was that I pant legs up, pull my shirt up, because you needed to have skin contact. Totally forgot that part.
Jeez.
I was going to figure out my grip. Totally forgot that part. And I just grabbed it. And so my legs slipped off, and it wasn't even my grip that I lost, which I was pissed about.
Right.
And I pretty much just stood in the water very gracefully.
Right. You're just like, dude, very nice.
Yes. There's no splash, Michael. I just stood.
Like a fun dive, very gentle. That's great.
Right. And they said, tell us what happened. I was like, I don't even know.
So have you ever thought about going back on?
I did. I actually applied for 2 more years and I didn't get accepted. So I threw in the towel and had other things to focus on.
Jeez. So how can people find you and your practice and what you do and your philosophy and how can people work with you and get in touch with you?
Yeah, so my website is www.movementparadigm.com. I have a YouTube channel, Dr. Arianne Missimer, and I post weekly videos of mindset, nutrition, and movement, which is the philosophy of the movement paradigm, and then Instagram, the movement paradigm, and Facebook as well.
Awesome. Can you bring us through a little bit more about your concepts on nutrition and what direction you take people in with that and when you're working with them?
Yeah, so I focus primarily on a functional medicine approach or functional approach to nutrition, which is just essentially looking at the whole body, all the systems working together. Definitely a huge emphasis on gut health. That's really kind of what I enjoy doing, and feel like I'm definitely seeing a lot of patients with that. So autoimmune or known gut issues, chronic pain. Those are the things I really try to focus on. A lot of people present with things like candida or SIBO or leaky gut, and just trying to kind of help people along their journey without making it super overwhelming.
Right.
So as a patient myself in functional medicine, I feel like it can be very overwhelming, and I try to just help people kind of with a step-by-step approach, figuring out how they can attack it.
Awesome. Now, do you have specific, if there was one thing that everybody you feel should start to incorporate into their diet and into their nutrition level, whether it be a supplement or a specific food, anything like that, what would it be if you had one thing that you would just tell people, all right, you need to start doing this?
I typically, to that question, which is very simple, but I always tell people to just have one more vegetable a day than they're already having. Nothing magic. Nothing magic. But
Right.
just the majority of people do not. And it's so hard for them to think about how to get them in and get them consistently that I think universally we could probably all get more vegetables in.
I've always loved vegetables. I've always been a big vegetable fan. Now I love a full diet. I love my meat as well. So that's not, Emily and I at home every night we have a big giant salad with probably about 12 to 13 vegetables inside the salad.
Awesome.
And then a protein. But so when I've talked to a couple people, I have some friends and family, younger cousins and things like that are just like, oh, I don't eat that stuff. I never touch such, it's just, there's not enough room on my plate for more vegetables. I
believe it.
We're not free anymore. It's not like you shouldn't have to have somebody to force feed you broccoli anymore. It's it's good for you.
I know, but that's what it's like with a lot of people.
I know. It's silly, even as adults. Like you would think, okay, it's your own health. You got to take it seriously and really take care of yourself.
You have to take ownership. Yeah, absolutely.
And then what about a supplement? Do you have anything that you feel that you find lacking in a lot of the people that you see or talk to that people really should be aware of and be taking?
I do, but I feel like it's always a little bit different. Like I'll just give an example is where I think most people should take a probiotic. There's a lot of people who can't tolerate a probiotic. People that, like, for example, have SIBO or have other specific gut issues similar to that. So although I'd like to say there's like one thing that's universal, I feel like really with supplements, I try to really figure out like what someone needs. I do micronutrient testing, not all the time, but definitely when I feel like it's appropriate. Or depending on what their condition is and what their symptoms are consistent with, do they need the whole anti-inflammatory protocol, or, do they need magnesium? Do they need, I kind of like figure out what are the things that person really needs and try to really make it as individualized as I can.
Right. One thing I know, we read a lot as a you, and we, as time has progressed and continues to progress, we know our food has less nutrients in it than it used to. Even from when we were kids, it was much higher nutrient density to the food that we ate than there is now. So we found, we supplement that in our home with a lot of supplements. We take a lot of supplements, but we found
a lot of supplements too, Michael.
People that are in this field usually they go above and beyond because we understand what's going on and we understand what's lacking and missing. So I know that especially during COVID, vitamin D and vitamin C and vitamin A are super important in this time and day and age right now. It could literally save some people's lives because it creates a barrier for the virus, so they really can't even approach you or attack you. So a lot of information has been coming out about that, so we're very adamant about that as well. And then magnesium, you mentioned it before. There's so many different kinds. We found this one complex that's just absolutely amazing.
Awesome.
It works really, really well. So
awesome.
Yeah.
I think I try not to overwhelm people with supplements. I think that can be. I respect the the relationship and things like that. So I'm always very careful about that.
Right.
Not to put, like, I recommend, but I let people come to their own decision on that, you know?
Cool. Well, I would love to thank you for joining me tonight. This has been,
Thank you.
I always enjoy talking to you and sharing some time with you. I really appreciate it.
Thank you so much.
Definitely. Can you just tell everybody one more time where they can find you, your website and everything?
Oh, absolutely. So themovementparadigm.com is the website, and then YouTube is Dr. Arianne Missimer, and Facebook and Instagram is The Movement Paradigm.
Awesome. Thank you again, Arianne. We appreciate it.
Thank you. Thanks so much, Michael. All right. Have a good night. Bye-bye.
You too. Bye. Thank you, Facebook. Talk to everybody soon. See you next week.